Hi, thanks for joining. My name's Melissa. I'm a nurse here with the Villages Health, as well as a population health specialist. Today we're going to talk about understanding vaccines. So first, let's go over a few definitions. The terms vaccine and immunizations are sometimes used interchangeably, but there is a difference. So the term vaccines is something that stimulates the body's own immune system to protect the person against subsequent infection or disease. On the other hand, the word immunization describes the actual changes your body goes through after receiving a vaccine. So vaccines we're going to discuss in this seminar are the influenza or flu vaccine, pneumonia vaccines, TD or Tdap vaccines, the Shingrix series, which are the new shingles vaccines, as well as the hepatitis A and B vaccines. Keep in mind you may need other vaccines based on your age, health conditions, job, lifestyle, or travel habits. These are just the most common and the ones we're going to discuss in this presentation. So why should people get the flu vaccine? So influenza or the flu is a potentially serious disease that can lead to hospitalization and sometimes even death. Every flu season is different, and the influenza infection can affect people very differently. Millions of people actually get the flu every year. Hundreds of thousands are hospitalized, and thousands to tens of thousands of people will actually die from flu-related causes every single year. An annual seasonal flu vaccine is the best way to help protect against the flu. Vaccination has been shown to have many benefits, including reducing the risk of flu-related illnesses, hospitalizations, and even the risk of flu-related death in children. So how do vaccines work? How does the flu vaccine actually work? Flu vaccines cause antibodies to help develop in the body about 2 weeks after vaccination. The antibodies provide protection against infection with the viruses that used to make the vaccine. The seasonal flu vaccine protects against the influenza viruses that research indicates will be the most common during the upcoming season. So once you actually get that shot in your arm, it takes about 2 weeks for it to really be working in your system. So it doesn't start immediately. Those antibodies begin to develop. So once you get the shot 2 weeks later, those antibodies are there to provide protection for you against the infection that the viruses could cause. And each year, researchers and scientists do create a new vaccine, and they hope to target the specific viruses that they're expecting to be more prevalent in that season coming up. So sometimes they're pretty spot on, sometimes it's a bit off, but usually they're very close. So getting the vaccine is very important to protect you. So some people ask, well, how do I know if I should get the flu vaccine? So you should discuss with your doctor, first of all, if they suggest that you get the vaccine. The guidelines show everyone over the age of 6 months should get the flu vaccine every year, like I said, with rare exception. The CDC, the Centers for Disease Control and Prevention Committee on Immunization Practices, have made this recommendation since the 2010-11 flu season. They've basically suggested that people 6 months and older should get the flu shot every year. The vaccination to prevent the flu is particularly important for people who are at a high risk of developing serious flu complications. So that just means depending on any other comorbidities or any other of your medical history, you could be at a higher risk for some symptoms or complications related to that flu virus. Now, some people that should not get the flu vaccine, children younger than 6 months of age, they're too young for the vaccine. Their bodies aren't quite ready for those antibodies. Also, people with severe or life-threatening allergies to the flu vaccine or any ingredient in that vaccine. That could include any allergies to gelatin, certain antibiotics, or other ingredients. You can see the special considerations regarding egg allergy for more information about egg allergies related to the flu vaccine. Again, if you have never gotten the vaccine and you're not sure if your doctor would suggest it, ask them. They have your medical history. They can review everything and see if this is something that they would suggest you start getting every year. Now, there are some special considerations. Talk to the doctor, see if the vaccine is right for you. So if you have an allergy to eggs or any of the ingredients in the vaccine, you definitely should talk to your doctor about that allergy. They may review your history and compare the allergies versus the vaccine and see if the risks are higher than the benefits. Also, if you've ever had Guillain-Barré syndrome, which is a severe paralyzing illness, some people with a history of Guillain-Barré should not get the flu vaccine. So if you have a history of that, talk to your doctor again to see if they would suggest you get it or don't get the vaccine. Other special considerations are if you're not feeling well, if you maybe have a cold, you have a fever, make sure you let the doctor know because they may want you to hold off for a week or two before you get the vaccine. So it's a good idea to tell the doctor if you have any unusual symptoms before you get the shot. They might want to just postpone it until all of that clears up. So some of the questions that we get asked about the flu vaccine. So the first question, where can I get it? Well, the answer is the Villages Health Care Centers. The flu vaccines are also offered in many other doctors' offices, clinics, the local health departments, even pharmacies around the area, some college health centers, as well as by many employers, even in some schools. Even if you don't have a regular doctor, you can get the flu vaccine anywhere else, like the health department, pharmacy, some urgent cares. A lot of them have walk-in flu clinics. You can come in, fill out the paperwork, get the shot, and go. Another question we hear is, why do I need a flu vaccine every year? So it is needed every year for a few reasons. First of all, a person's immune protection from the vaccine declines over time. So an annual vaccine is needed for the optimal protection because if you get one this year, by next flu season, you won't have that full protection that you should have. Second reason, because the flu viruses are constantly changing. So like I said, they are prepared ahead of time for the upcoming flu season. So we don't know what this coming flu season will be compared to the previous one. So you need one every year because it is ever changing. The viruses and the strains may be different from year to year. So again, for the best protection, everyone 6 months and older should get vaccinated annually. Another question, does the flu vaccine work right away? No, it does not. So once you get the shot, it takes about 2 weeks for the antibodies to develop in your body and to provide the protection against that virus. That's why it's good to get vaccinated before influenza viruses start to spread in your community. So talk to your doctor. They may suggest the end of September, even October. That way you're covered for the entire season and that vaccine has time to really get in your body and get working to protect you. Another question we get asked often are, what are the common side effects from the flu vaccine? So the flu vaccine cannot give you flu illness. There are some side effects that may be associated with getting a flu shot that we do see. So they're usually mild and short lasting, especially with compared to the symptoms of a bad case of the flu. The viruses in the flu shot are inactivated, they're killed, so you're not getting the flu from the flu shot. But some of the minor side effects that you might experience are soreness, redness, or swelling at the site of your injection of where they gave you the flu shot. You might get a headache or a low-grade fever. You might have some muscle aches, even some nausea, fatigue. Sometimes people do experience a few of these, but like we said, they're usually mild and only last for a day or two. So now we'll move to the pneumonia series, the pneumonia vaccines. Pneumococcal disease is common in young children, but older adults are at a greater risk, at the greatest risk of serious illness and death from pneumonia. Vaccines are the best way to prevent pneumococcal diseases. So there are 2 vaccines used in the United States to help prevent us from these 2 diseases. There's the pneumococcal conjugate vaccine, which we call the PCV13, or you might hear it called the Prevnar 13. Then there is the pneumococcal polysaccharide vaccine, or the PPSV 23, or the Pneumo 23. So you might hear them called a few different things, but there are 2 vaccines to protect us against the pneumococcal disease. The vaccines are good at preventing severe pneumococcal disease, which often require treatment in the hospital and can be deadly, especially for older adults. However, please keep in mind that the vaccines will not prevent all infections. Now we talked about the 2 different types of vaccines, so we'll go into that a little deeper. You have the Prevnar 13 or the PCV 13. The CDC, the Center for Disease Control and Prevention, recommends the PCV 13 for all children younger than 2 years old, for people 2 years or older with certain medical conditions. Also, adults 65 and older might discuss and decide with their doctor that they should also be considered for this vaccine. That's the Prevnar 13 or the PCV 13. Now on the right column here, we have the pneumococcal polysaccharide vaccine, or PPSV 23. So the CDC recommends the 23 for all adults 65 and over, people ages 2 through 64 years old with certain medical conditions. Also for adults 19 years old through 64 years old who smoke cigarettes. Now, some groups may need multiple or booster doses, so it's a good idea to talk to your doctor about what's best for your specific situation given your medical history. And ask questions. The doctors can't read your mind, so if you have questions, ask them. That's what they're there for, to give you all of the education that you need to keep your health up to par where it should be. All right, some frequently asked questions that we get from the pneumonia vaccines, the pneumococcal vaccines. What are the common side effects? Most people don't have any serious problems with the vaccines, but with any medicine, including vaccines, there is a chance of some side effects. They're usually mild and go away on their own within a couple days, but serious reactions are always possible. Mild problems following the pneumococcal polysaccharide, the 23 vaccine, can include reactions to where the shot was given. So might have some redness, swelling, or pain at the injection site, or some muscle aches and pains. Another question, where can I get these vaccines? Well, the villages healthcare centers, of course. You can also get these at the pharmacies. Some workplaces offer them. Some community health clinics, health departments, and other locations. All right, so question, who should not get the pneumonia vaccines? So the answer, so first we'll talk about the Prevnar 23, the conjugate vaccine. People who have a mild illness, such as a cold, can probably get the vaccine, but if you have a more serious illness, you might want to wait until the symptoms recover, until you're fully recovered from whatever that is. Now, that also is something that you should talk to your doctor about and see if they want you to wait a couple weeks until you're feeling better. Let them know, if you've had a fever, you have some flu or some cold-like symptoms. Also, anyone that's had a life-threatening allergic reaction to any of the following should not get the Prevnar 13 vaccine. So if you've had a reaction to a dose of this previously, if you've had an earlier pneumococcal conjugate vaccine called the PCV7, If you've had a reaction to any vaccine containing diphtheria toxoid, so the Tdap, you should not get the Prevnar 13. Also, with anyone with a severe allergy to any component of the Prevnar 13 should not get this vaccine. Your healthcare provider can tell you about all of the components that make up the vaccine. So the two of you as a healthcare team can decide if that's a good vaccine for you to get. So who should not get the Pneumo 23 vaccine? Children younger than 2 should not get this one. Anyone that's had a life-threatening allergic reaction to the Pneumo 23 should not get another dose. Anyone who has had a severe allergy to any component of the Pneumo 23 should not get it. Also, if you have a mild illness, such as a cold, you can possibly get it, but you should talk to your doctor first so they can advise you if it would be okay or if you should postpone it a couple weeks. Now, as per the CDC website, there's no evidence that the Pneumo 23 is harmful either to a pregnant woman or to her baby. However, as a precaution, women who need the vaccine should try to get it before becoming pregnant. But again, if this is something that you're questioning or maybe a concern, talk to the doctor because they can advise you what would be best for your specific condition. All right, now we're going to move right along to the tetanus, diphtheria. So these are just some facts. So tetanus and diphtheria are very serious diseases. They're rare in the United States today, but people who do become infected often have some very serious complications. The TD vaccine is used to protect adolescents and adults from both of these diseases. Both diphtheria and tetanus are infections caused by bacteria. Diphtheria spreads from person to person through secretions from either coughing or sneezing. Tetanus is caused by bacteria that enter the body through cuts, scratches, or wounds. So going a little bit deeper, tetanus, which is sometimes called lockjaw, causes painful muscle tightening and stiffness, and it usually occurs all over the body. It can lead to tightening of the muscles in the head and neck, so you eventually cannot open your mouth. You can't swallow, and sometimes it's difficult to breathe. Tetanus actually kills about 1 out of every 10 people who are affected, even after receiving the best medical care. So this is a very serious condition. Diphtheria can cause a thick coating to form on the back of the throat. It can then lead to some breathing problems, heart failure, paralysis, and even death. Before we had the vaccines, as many as 200,000 cases of diphtheria and hundreds of cases of tetanus were reported in the United States every year. But since the vaccine, reports of cases for both disease have dropped by about 99%. So these work. So it's definitely something, these vaccines are good, they're beneficial, they're protecting us. So talk to your doctor if this is not a vaccine, if this is a vaccine you haven't ever received, talk to your doctor to see if they think you should get that so you can get up to date. More about the tetanus, diphtheria. The TD vaccine can protect adolescents and adults from tetanus and diphtheria. TD is usually given as a booster shot every 10 years, but it can also be given earlier, specifically after a severe or dirty wound or burn. It may be given safely at the same time as other vaccines. You should not get this vaccine if you've ever had a life-threatening allergic reaction after a previous dose of any tetanus or diphtheria containing vaccine, or if you've had a serious allergy to any part of this vaccine. You should not get it. Tell the person giving the vaccine about any serious allergies that you have. You should also talk to your doctor if you've ever had severe pain or swelling after any vaccine containing diphtheria or tetanus. Tell your doctor if you've ever had a condition called Guillain-Barré syndrome, GBS. Also tell your doctor if you aren't feeling well on the day of your shot. Again, for this one as well, they may want to postpone it until you're feeling better. So some of the side effects, they can range from mild, moderate to severe. Very rarely do we see problems with it. Most people don't have any problems, but just so you're aware, some mild problems following the TD vaccine, and these were noted to not have any interference with any of the people's daily activities. So they may have some redness or swelling where the shot was given. That was about 1 person in 4 reported that. Pain where the shot was given, a little bit of soreness, about 8 out of 10 people reported some pain. Very rare for a mild fever. Also headache or tiredness, about 1 in every 4 person complained of that. So again, they said these did not interfere with any of their daily activities. Moderate problems, which they did report, did interfere but did not require medical attention. Fever over 102 degrees Fahrenheit. This was rare, but it was reported. And then a severe problem noted after the TD vaccine where the person was unable to perform usual activities, and this did require medical attention, was swelling, severe pain, bleeding, and or redness in the arm where the shot was given. Now, this was very rare, and we, like I said, very rarely see anyone having any interfering symptoms after getting this vaccine. But if you're concerned, talk to your doctor and they can go over it in a little bit more detail with you. So now we're going to move to the Tdap. So this one also has tetanus and diphtheria, but this one also has pertussis. Pertussis is what we call the whooping cough. So tetanus, diphtheria, and pertussis are very serious diseases. The Tdap vaccine can protect us from these diseases. And the Tdap vaccine given to pregnant women can actually help protect newborn babies against the pertussis. So pertussis, as we said, is what we call whooping cough. Causes severe coughing spells, which can cause difficulty breathing, vomiting, and disturbed sleep. It can also lead to weight loss, incontinence, and rib fractures because of the severe coughing. Up to 2 in every 100 adolescents and 5 in every 100 adults with pertussis are hospitalized or have complications, which could then lead to pneumonia or death. These diseases are caused by bacteria. Again, diphtheria and pertussis are spread from person to person through secretions from coughing or sneezing, and tetanus enters the body through cuts, scratches, or wounds. So who needs the Tdap? Who needs the Tdap vaccine? The Tdap can protect adolescents and adults from tetanus, diphtheria, and pertussis. 1 dose of the Tdap is routinely given at age 11 or 12. People who have not gotten the Tdap at that age should discuss with your doctor as soon as possible to see if this is something that they would suggest. Tdap is especially important for healthcare professionals and anyone having close contact with a child younger than 12 months. Because those kids, those babies less than 12 months, less than 1 year old, are at a very high risk for developing whooping cough, the pertussis. Pregnant women should get a dose of Tdap during every pregnancy to protect the newborn from pertussis. Infants are most at risk for severe life-threatening complications from this as well. So another vaccine that we discussed previously called the TD, that protects against tetanus and diphtheria, but it does not cover the pertussis. It does not cover the whooping cough. So a TD booster should be given every 10 years. Tdap may be given as one of those boosters if you've never gotten the Tdap before. Tdap may also be given after a severe cut or burn to prevent tetanus infection. All right, moving right along. Next one we'll discuss is the Shingrix series. This is the shingles vaccine. Most people have either heard of someone or personally experienced the shingles enough to know that you don't want it again, or you don't want to ever get it. So shingles vaccine is the only way to protect against shingles and post-herpetic neuralgia, PHN, which is the most common complication from shingles. The CDC recommends that healthy adults 50 years of age and older get 2 doses of this shingles vaccine called Shingrix. It's actually a recombinant zoster vaccine separated by 2 to 6 months to prevent the shingles and complications from the disease. Your doctor or pharmacist, wherever you go to receive the vaccine, they will give you the shot in the upper arm, the deltoid muscle. Now it says you need 2 doses, so these are the same vaccine. You'll get it twice. So you get the first shot, and then the guidelines show that you should wait 2 to 6 months. There's a little variation there, and then get the second shot for full effectiveness. The Shingrix vaccine actually provides strong protection against shingles and PHN, that post-herpetic neuralgia. 2 doses of the Shingrix is more than 90% effective at preventing shingles and PHN. Protection stays above 85% for at least the first 4 years after you get vaccinated. So those numbers are pretty good. There was a previous shingles vaccine that was offered 4 or 5 years ago. That now come to find out it's only about 20 to 30% effective. So if you got that vaccine, you still should be getting this vaccine, the Shingrix vaccine. So who should get this? Healthy adults 50 years of age and older should get 2 doses of the Shingrix, again, separated by 2 to 6 months. You should get Shingrix in the past. Even if in the past you have had shingles, you actually should definitely talk to your doctor about getting it, because if you get the shingles again, it could be worse than it was the first time. You should get the Shingrix series, even if in the past you had the Zostavax, that old shingles shot. Also, if you're not sure if you've ever had chickenpox, you still should get the Shingrix vaccines, just for full protection. There is no maximum age for getting these 2 shots. If you had shingles in the past, you can get Shingrix to help prevent future occurrences of the disease. Because as we said, if you do get the shingles again, it may be worse than it was the first time. There's no specific length of time that you need to wait after having shingles before you can receive it, but generally you want to make sure the rash has completely gone away, not even any marks left. So talk to the doctor. They may suggest like 4 to 6 weeks. Maybe even longer, just to be sure that has completely gone out of your system. You can get the Shingrix vaccines, whether or not you remember if you've ever had chickenpox in the past. Studies actually show that more than 99% of Americans 40 years and older have had chickenpox, even if they don't even remember. Chickenpox and shingles are related because they are caused by the same virus, which is called the varicella zoster virus. And after a person recovers from the chickenpox, the virus actually stays dormant, which is inactive in the body, but it can reactivate years later, then causing shingles. So it's a good idea to get the Shingrix series if you've ever had chickenpox, even if you don't know that you have. If you got the Zostavax a few years back, that wasn't very effective, so you should get the new vaccines as well. Now, people that should not get the Shingrix are if you have ever had a serious or severe allergic reaction to any component of the vaccine, or after a dose of Shingrix. You should not get it if you have tested negative for immunity to varicella zoster virus. If you test negative, you should get the chickenpox vaccine. Also, you should not get the Shingrix vaccines if you currently have shingles. You need to wait until that completely 100% clears up and gets out of your body. Also, if you're currently pregnant or breastfeeding, you should wait until after you deliver or after you're finished breastfeeding to get the vaccines. If you have a minor illness, such as a cold, you may still get the Shingrix vaccine, but if you have a moderate to severe illness, you should let the doctor or nurse know. That includes anyone with a temperature of 101.3 or higher. But if you have any symptoms, any concerning symptoms of a possible cold, let them know, because they still may want to have you wait a week or 2 before you get the vaccine, just to hopefully prevent any possible side effects. Now we will talk about some side effects. So studies have shown that the Shingrix is safe. The vaccine helps your body create a strong defense against the shingles. As a result, you're likely to have some temporary side effects from getting the 2 shots, and they may affect your ability to do your normal daily activities for a couple days. Most people, and that is most, got a sore arm with a mild to moderate pain after getting the Shingrix vaccines. And some also had redness and swelling where they got the shot. So this is probably the most common side effect that we hear. Some people also felt tired, had some muscle pain, headache, shivering, fever, stomach pain, or nausea. About 1 out of every 6 people who got the Shingrix vaccines experienced side effects that prevented them from doing their regular daily activities. But they did note that the symptoms went away on their own after a couple days, 2 or 3 days. And the side effects were more common in younger people. So not saying if you're 65 and over, you won't get any of the symptoms. You may get the side effects still. And they may be debilitating for a few days that prevent you from doing your regular activities. But on average, people are saying that they go away on their own after a couple days. Now, you might have a reaction to the first or second dose of the Shingrix, one or the other, or you could experience a reaction after both. If you experience some side effects, you might choose to take an over-the-counter pain reliever like ibuprofen or Tylenol, but you should check with your doctor to see which one they would suggest for you. All right, so we are moving to hepatitis A. So the term hepatitis means inflammation of the liver. When the liver is inflamed or damaged, its function can be affected. Drinking a lot, having a heavy alcohol use, some toxins, certain medications, and some medical conditions can actually cause hepatitis, but a virus often causes it. In the United States, the most common hepatitis viruses are hepatitis A, B, and C. We'll talk about hepatitis A. It's a highly contagious liver infection caused by the hepatitis A virus. It can range from a mild illness lasting only a few weeks to a severe illness lasting several months. Although rare, hepatitis A can cause death in some people. It's usually spread when a person unknowingly ingests the virus from objects, food, or drinks contaminated by small, undetected amount of stool from an infected person. Most people who get hepatitis A feel weak for several weeks, but they usually recover completely and don't have any lasting liver damage. There are some very rare cases where hepatitis A can cause liver failure and death. This is more common in people older than 50 and also in people with other liver diseases, though. There was a study back in 2017 showing there were an estimated 6,700 cases of hepatitis A in the United States. And outbreaks of hepatitis A are occurring across the United States since first identified in 2016. There have actually been more than 25,000 cases reported. So just some facts there for you. Hepatitis A usually spreads, like we said, when a person unknowingly ingests a virus from objects, food, or drinks contaminated by small, undetected amounts of stool from an infected person. Hepatitis A can also spread from close personal contact with an infected person, such as through sex or caring for someone who is ill. Now, the contamination of food, which can be frozen and even undercooked food by hepatitis A, can happen at any point. Any stages of that. So it can be from the growing, the harvesting, processing, handling, even after cooking, the whole process, if it's infected, the contamination can occur. The contamination of food or water is more likely to occur in other countries, however, where hepatitis A is common, and in areas where there are poor sanitary conditions or poor personal hygiene. Here in the United States, chlorination of water kills the hepatitis A virus that enters the water supply. So that is beneficial here, but there are other countries where it is more prevalent because of the sanitary conditions. People that are at risk, anyone can get the hepatitis A in the United States, but certain groups of people are at the higher risk. People with direct contact with someone who has a diagnosis of hepatitis A, someone that travels to the different countries where hepatitis A is more common, men who have sexual contact with men, people who use drugs, both injection and non-injection drugs, household members or caregivers of a recent adoptee from countries where hepatitis A is common, also people with clotting factor disorders such as hemophilia, or people working with non-human primates. So all of these people are at a higher risk for getting hepatitis A. Some common symptoms that we see, older children and adults typically do have these symptoms. They can occur pretty abruptly, such as fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, diarrhea, clay-colored stools, joint pain, or jaundice, which is the yellowing color of the skin and eyes. These are just the common symptoms that we do see with hepatitis A. Some questions. So how soon after exposure to hepatitis A will the symptoms appear? If symptoms occur, they usually start appearing after 4 weeks from the initial exposure, but they can occur as early as 2 and as late as 7 weeks after exposure. But the symptoms usually develop over a period of several days. Second question, how long do hepatitis A symptoms last? The symptoms usually last less than 2 months, although some people, around 10 to 15% with hepatitis A, can have symptoms for as long as 6 months. Next question, can a person spread hepatitis A without having symptoms? The answer is yes. Many people, especially children, have no symptoms. In addition, a person can transmit the virus to others up to 2 weeks before the symptoms appear. So you may have hepatitis A with no symptoms at all, feeling fine, and you could be transmitting the virus to others. So if any of those symptoms relate to you, you definitely should get in touch with your doctor. Now, some vaccine facts for the hepatitis A. So it's actually, the first question, how is it given? So it's a safe and effective vaccine given as 2 shots, about 6 months apart. Both shots are needed for the long-term protection. It also comes in a combination form containing both hepatitis A and B vaccines that can be given to anyone 18 years of age and older. The combination vaccine, though, is given as 3 shots over 6 months. And for the combination, all 3 shots are needed for the long-term protection for both hepatitis A and B. Second question, is the vaccine effective? The answer is yes. The hepatitis A vaccine is highly effective in preventing hepatitis A virus infection. A second hepatitis A shot results in the long-term protection. So you definitely should get both, and they are effective. Third question, is it safe? Yes, it is safe. No serious side effects have been reported from the vaccine. There has been some common reports of some soreness at the injection site. As with any medicine, there's always a small risk that a serious problem could occur after you get this vaccine. However, the potential risks associated with hepatitis A are much greater than the potential risks associated with getting the vaccine. So the risk of actually developing the hepatitis A virus is much higher than the potential risk associated with the vaccine. Now moving right into hepatitis B. Hepatitis B is a liver infection. It's caused by the hepatitis B virus. And for some people who get hepatitis B, the virus stays in the body, causing a lifelong illness. Hepatitis B can cause serious health problems over time, and these problems could include liver cancer or liver failure. In the United States, hepatitis B is very common among Asian Americans. Even though Asian Americans make 5% of the US population, they account for up to half of the 862,000 Americans living with hepatitis B. In the United States, an estimated 862,000 people have chronic hepatitis. Globally, there's approximately 257 million people living with chronic hepatitis B. So those are staggering numbers. The symptoms of hepatitis B, sometimes there are no symptoms. Many people can live with hepatitis B for decades without feeling sick. But if and when symptoms do occur, they can include fever, feeling tired, not wanting to eat, stomach pain, upset stomach, vomiting, dark urine, light or clay-colored stool, joint pain, or jaundice, which is that yellowing skin or eyes. Another question is, how serious is hepatitis B? So while hepatitis B is a lifelong infection, it can become very serious with long-term health problems. About 1 in 4 people with chronic hepatitis B develop serious liver conditions, including liver damage, liver failure, or even liver cancer. And again, hepatitis B is the leading cause of liver cancer among Asian Americans. The hepatitis B is spread when blood, semen, or other body fluid infected with hepatitis B virus enters the body of a person who is not infected. People can become infected with the virus from a few different ways. So they can be infected from birth. It can be spread from an infected mother to her baby during birth. It can be spread through sex with an infected partner. Also shared through sharing needles, syringes, or drug preparation equipment. Also through sharing items such as toothbrushes, razors, or medical equipment such as glucose monitoring machines with an infected person. Also through direct contact with the blood or open sores of an infected person, as well as exposure to blood from needle sticks or other sharp instruments of an infected person. Now, the hepatitis B virus is not spread through food or water. Sharing eating utensils, breastfeeding, hugging, kissing, holding hand, coughing, or sneezing. So some vaccine facts for the hepatitis B. The vaccine schedule most often used for children and adults is 3 intramuscular injections. So most commonly we do that in the upper arm in that deltoid muscle. The second and third doses are administered at 1 and 6 months, respectively, after the first dose. The hepatitis B vaccine stimulates your natural immune system to protect against the hepatitis B virus. And after the vaccine is given, your body starts to make antibodies that protect you against this virus. An antibody is a substance found in the blood that's produced in response to a virus invading the body. So your body is going to work for you. These antibodies will fight off the infection if a person is exposed to the hepatitis B virus in the future. The hepatitis B vaccine is safe. Soreness at the injection site is the most common side effect reported, as with most of the other vaccines we talk about. But with any medication, there are very small risks that a serious problem could occur after getting the vaccine. That's pretty much across the board. We know what the most common side effects are, but sometimes there are some other serious problems that could possibly occur, but that varies person to person. Now, this is a table that we pulled from the CDC, the Centers for Disease Control. This is the recommended adult immunization schedule by age group, and this was posted last year, 2019. So you can see from 19 to 21, 22 to 26, 27 to 49, 50 to 64, and then 65 and over. These are all of the recommended vaccines as per the CDC. Now, you should discuss with your doctor if the ones listed on the table here are suggested for you personally. Considering any allergies or other medical conditions you may have, that would be a good question to ask the doctor. So I hope you enjoyed and you got some great information from this seminar. If you have any questions or comments, please call us at the Villages Health Learning Center. And I hope you have a wonderful day. Thank you.